Every year, cancer reportedly kills close to 10 million people worldwide, and here in Korea, cancer has been the leading cause of death since 1983. So what is behind the prevalence of cancer here and elsewhere? Which common cancers are preventable and treatable? Where does Korea stand in terms of cancer prevention, detection, and treatment? Welcome to Issues and Insiders. Come tomorrow, that is Saturday, February 4th, we mark World Cancer Day. That being said, today we address the prevalence of this disease and more. For that purpose, I have Doctor Ihn Yohan from Severance Hospital here in the studio. Dr. Ihn, it's a pleasure to have you with us.
Thank you for inviting me.
I also have Dr. Dan from MizMedi Women's Hospital with us as well. Dr. Dan, it's been a while. Welcome back.
Thank you for having me.
Right. Dr. Ihn and Professor Ihn, of course, as you teach at Yonsei University as well. Let's start with a few words on the rate of cancer per country and its impact on mortality, including here in South Korea.
South Korea's cancer rates have been changing drastically with the westernization of diet. So other than stomach cancer, most cancers are on the rise in South Korea. This is a strange answer, but it also has to do with longevity. The longer you live, the more you are exposed to carcinogens and what we call oncogenes, which cause cancer. There are some directly causes of cancer, but to say that there's a universal cause is not possible. It doesn't make sense.
Right. How would you compare the prevalence of cancer here in Korea to that of its counterparts, perhaps? Very generally speaking.
To other countries?
Yes.
Cancer here is actually, the longevity after diagnosis is above most Western countries.
I see.
This has to do with, or probably do with early detection and a lot of the health promotion centers that the hospitals and the society. Also, the Korean national insurance system is very aggressive. If you're past a certain age, you get on the mobile phone, you should have your colonoscopy, you should have your endoscopy. These things these methods are very good tools for early diagnosis. If you diagnose early, then the cancer can be removed and you have more 5-year survival is better actually than the US or most of Europe.
Right, I see. And Dr. Dan, before we go any further, do tell us a bit about World Cancer Day and its significance.
Right, so World Cancer Day is observed every year on February 4th. And it's because February 4th is the birthday of World Cancer Day. It was first started in the year 2000 at the World Summit Against Cancer, which is held in Paris, France. And it's a day when people, governments, institutions can focus on cancer. And it's a day when people can really raise awareness about cancer. There are events that are going on around the world, and also sort of focus attention on the need for more research, for patient advocacy, and for the importance of screening, diagnosis, and treatment of cancer. It is the second leading cause of death in the world, and so attention is really needed in terms of improving the rates of cancer survival around the world.
Right, I see. And Professor Ihn, you've clarified that the cause of cancer cannot be universal. And that being said, what do you suppose are some of the causes of cancer then here in the country?
Well, not all cancers can be, cannot generalize, but for example, for cervical cancer in ladies, human papillomavirus is known to be the cause. And there's actually a vaccination called Gardasil, which you can have at a younger age to prevent the virus, which in turn prevents the cancer. Also, one of the most common cancers in Korea is stomach cancer, and genetics is part of the cause, and diet is part of the cause. But Helicobacter is a very important causing factor of cancer, and if you eliminate Helicobacter, the risk of the cancer goes down. So for each type of cancer, we can look at preventive methods. But many other cancers, we don't understand the great increase, for example, in colon cancer in Korea, We don't understand why breast cancer is going up, thyroid cancer. We don't have an exact cause, but we are suspicious of animal fat diet increase in taking in what you eat, your lifestyle causing it.
Right.
But again, for each type of cancer, we must look at variable causes.
Right, of course. Dr. Dan, generally speaking, where does Korea stand in terms of cancer prevention, cancer detection, and its treatment, would you say?
Well, I would say in South Korea, healthcare in general has achieved a somewhat enviable position, I would say, of having achieved healthcare for all. We have universal healthcare in South Korea. And we also have healthcare that is high quality, accessible, and affordable. And I would say that's the same for cancer care as well. We have a very well-organized national system for screening for cancer. The National Cancer Screening Program started in 1999, and it's actually required for all Korean nationals to receive routine, regular cancer screening. In terms of overall cancer care and statistics, a study performed by the National Cancer Center showed that for all cancers in Korea except brain cancer, CNS cancers, the overall 5-year survival improved over the last 20 years. And I think that's a testament to the quality of healthcare, to the diagnostics, and the availability of treatments. And so it's hard to rank, obviously, different countries in terms of cancer care, but we have the statistics, and the statistics show that we are improving the survival of cancer here in South Korea.
Right, and talking about survival of cancer, you mentioned, Professor Ihn, that Korea does hold a high cancer survival rate compared to its counterparts. Do you care to elaborate on that a little bit?
Do I what?
Care to elaborate?
Yes, I would say it's because as she mentioned, it's because of the national insurance system is centralized and focuses very now more and more on prevention, early detection. I think that's the key word. And also because there's a lot more health promotion.
Raising awareness about the dangers of cancer.
Where you can pay extra and have cost effectiveness is not as high, but for the individual who finds the very rare cancer early and has it removed, all solid tumors have to be removed. Leukemia and lymphoma are exceptions, but most cancers have to be removed from your body for there to be a cure. And that is, Koreans are very good at that. And the university hospitals in Korea have some very super expertise. They also have very expensive, very state-of-the-art equipment. So, life-threatening diseases in Korea are handled very proactively, very quickly. Amazingly, I think we've basically in the last 20 years passed up the West and do actually a better job than is done in the United States or in Europe.
I see. And staying with this optimism, Dr. Dan, do correct me if I'm wrong. I understand that the number of foreigners seeking medical care here in South Korea has been on a rising trend before it was interrupted, of course, by the pandemic. How do you explain this reality?
Right. So it's not by accident, it's by design. And I would say that the pivotal changing point for this was in 2009 when legislation was passed that made medical tourism legal in South Korea. Previously, prior to that time, it wasn't. There has been an increased demand overseas for people to travel beyond their borders for their medical care, either because they're seeking a better value for their healthcare dollars or because they're seeking treatments for conditions that can't be addressed where they live. And South Korea has really made an effort to meet this demand. In terms of medical needs. Another piece of key legislation was passed in 2016 where the government really recognized the healthcare industry as a driver for the economy and also for growth here in South Korea. And so because we have really made an effort on the government level, on the private levels, individual hospitals as well, to address the needs of the healthcare needs of foreigners. That's really why we have seen an increase in people coming to Korea for their medical care.
Right, and staying with that, Professor, has there been a tangible boost in the number of cancer patients from abroad seeking care at your hospital?
Oh, definitely. At our cancer center, this morning I did rounds, and there's, nearly a dozen patients admitted to the cancer center from foreign countries. And you've got to make this very clear that some of the developing countries just don't have the facilities or the expertise. So they're here in Korea to, medical tourism is the word used, but they're here for more high quality treatment. And they have it's affordable to those that are coming. Again, we have the plastic surgery in Gangnam that's very, very busy. But more and more, at least in university hospitals, we're not seeing mild cases of surgical, but severe, life-threatening blood vessel, heart and brain diseases, and to put simply, and then cancer-related diseases. And Korea is very good at, and another thing that's very important, it's very affordable compared to Germany, compared to Western countries. Korea's price is much lower for very high quality care. So a lot of people are looking at their options, and they're coming to Korea.
Right, I see. Dr. Dan, it's been said that about a third of common cancers are preventable and also treatable. Could you tell us a bit about what they are and how can they be prevented?
Right, so during COVID-19, there was a lot of attention paid to vaccines and vaccinations, but did you know that we have vaccinations to prevent cancer as well? So as Professor Ihn Yohan mentioned, human papillomavirus, we have a vaccine now, and that can be used to prevent cervical cancer. The hepatitis B vaccine is used to prevent liver cancer, not all liver cancer, but many types of liver cancer. Also, we know that certain exposures can increase the risk of cancer, and so limiting exposure, for example, to the sun by using sunblock or wearing a hat can decrease your chances of skin cancer. There are certain occupational exposures to chemicals that are known to cause cancer, and so keeping an eye to prevent those kinds of exposures is important. Lifestyle choices are also very important. What you eat, how much you exercise, whether you smoke, drink alcohol, whether you have an active lifestyle. These can all impact your risk for cancer. And then lastly, I would say screening is so important because through routine, regular screening, we can detect cancers in the pre-cancer stage. And of course, early detection, early treatment improves your chance of survival. And so that's why we recommend upper endoscopy for stomach cancer, pap smears for cervical cancer, mammographies for breast cancer, colonoscopies for colon cancer, liver ultrasound for people who are at high risk of liver cancer, and low-dose CT scans for people who are at high risk for lung cancer. Of course, not everyone has to do all these tests all the time. There are risk adaptive guidelines in place because we want to catch the cancers that count. We want to avoid, of course, overdiagnosis and overtreatment as well. But following guidelines that are risk adaptive is very important and definitely makes a difference in terms of survival.
Right, of course. Professor Ihn, broadly speaking, do you suppose Korea's handling of the pandemic, especially in its early stages, has perhaps raised the country's standing in the global medical arena, would you say?
The only thing lacking was probably in the initial stages was blocking flights from China. That was a little bit delayed. But other than that, Korea did a fantastic job. And there's a lot of grumbling in Korea, a lot of unhappiness. But at the end of the day, the bottom line is the Korean people got behind the recommendations and followed the rules. And I think that's was very, very important. In many Western countries, there were demonstrations, there were a lot of unhappiness, and people did not obey the public health officials. But with Delta, we did a very good job in the initial stages, and we should be commended. We should be very proud of this. Now, Omicron is much more infective, but fortunately less lethal. And I think the vaccine, the most important thing is vaccine is not necessarily, if you look at it philosophically, to prevent the disease. It's to prevent side effects after you've had the disease. That lethal side effects is not the word. Complications that the disease can bring you, like pneumonia or life-threatening things. So Korea, yes, the Korean people probably should be applauded. The health officials did a good job, the government did a good job, and the Korean people obeyed. I think that the Korean public should be very proud of the way that COVID was handled and continues to be handled to this day.
Right. Dr. Ihn, Korea hopes to expand its presence in the global medical arena, of course. That being said, what do you propose to make this hope a reality?
We need to focus on a couple things. First of all, we really need government funding, support in this arena. Secondly, as a doctor, I always say that the needs of the patient always come first. So I think also if we're dealing with a global population in terms of who our patients could be, we need to listen to what their needs are and make sure that their needs are matched. Both my parents are actually cancer survivors. Back in 2007, when my parents were living in Texas at the time, I took my mother to get her cancer treated at the MD Anderson Cancer Center in Houston, Texas. And in 2008, when I started working in international health here in Korea, I often thought that if Korea followed the model of the Texas Medical Center, which is the largest medical center in the world, they see 10 million patient visits every year. If we could perhaps follow that model, that would really catapult South Korea's healthcare system onto the global stage. And the Houston Medical Center, they pride themselves in being leaders in collaborative medicine.
What does that mean?
Right. So I think here in Korea, we have a lot of competitive medicine. We try to compete with each other, to try to be the best, to try to be number one. But if our medical centers could collaborate, there are 21 hospitals in the Texas Medical Center, and they all collaborate with each other to bring a package of medical care that is excellent beyond others. And I think if we took a more collaborative approach in terms of our healthcare offerings in South Korea, that could perhaps bring up the value of South Korean healthcare overall, compared to other countries perhaps around the world.
Right. And Professor Ihn, what do you suggest perhaps to enhance Korea's medical infrastructure and to ultimately offer better care as highlighted by Dr. Ihn?
Well, the Korean national health insurance system is based on quantity, not as much on quality. The Korean doctors see, I would say, 5 times the number of patients that Western doctors see. They are very busy. So I think in infrastructure, we should more, for foreigners coming for treatment, look at quality and service. This needs to be enhanced. Singapore, Thailand are both good examples of very good service. We can do benchmarking from them. This needs to be increased. And also a fundamental philosophical thought has got to change. When you think of the medical field, in Confucianism, you're always thinking about sacrifice of the doctor. Sure, we must take care of the underprivileged and and people that need help, that are poor. But this medical tourism is a business. It is a industry. And we've got to look at it as an industry in the future. Korean doctors are very talented. They're very good with their hands. It's very high-tech, state-of-the-art. And we may not be all aspects of medical tourism, but the high-quality, very high-skilled medical tourism is a big industry that Korea should go into, and that more investment should be made. And frankly, it should not just be done, shall we say, the private sector should be allowed to invest. I think I'm a strong believer in getting funding and building hospitals for, this is like Samsung and Hyundai, it is another industry. So we should look at it more. And of course, we need to help poor people, but at the same time, this is an industry that needs to be developed.
Right, I see. And talking about development, Professor, and there's a shortage, a severe shortage that is, of pediatricians here in the country. Are there any measures being taken by your hospital to deal with that issue?
I actually have been talking with the government myself. I'm not a pediatrician. I have a year of pediatric training, but there has got to be a shift. The government right now is pulling back on some of the abuses of the systems and getting CT and MRIs. That austerity is very important, but at the same time, pediatricians are not compensated adequately. We have 11 pediatric resident positions in our hospital this year. Not a single one is filled. Nobody wants to become a pediatrician. Something has drastically got to change. There's got to be incentive. There's got to be financial rewards. We must take care of our future children. We've got to invest more in pediatrics. I'm a strong believer that the current government should take a active role, a proactive role in turning things around, because nobody wants to be a pediatrician. It's very sad.
Right, it really is. And Dr. Ihn, we have like a minute left, which is why I'm going to ask you this next question about public health here, of course, because starting this week, indoor mask requirements have been eased here in South Korea. That being said, let's end with a few words of safety tips that you can give us to keep us safe in this new phase of the pandemic.
Right. Well, as many people probably know, the WHO, they decided to keep COVID-19 as a public health emergency of international concern, recognizing the dangers that this disease still pose to the public. So I would say know your risk of severe disease. Be aware of your own personal risk. If you are a high-risk person, keep your mask on in public. Make sure you avoid crowded, indoor, poorly ventilated spaces. Practice good hand hygiene as well. For people who are at very, very low risk, it's not as, in terms of transmission levels and risk, it's not as dangerous as it was before, definitely in our country. But in order, as we know, COVID-19 is not just about me, it's about our community. It's about protecting everybody and our families, people who have immunocompromised, people who do not mount as strong immune response after vaccinations. So make sure you're up to date on your vaccinations, make sure that your family members are also up to date on vaccinations. Know your risk, have a plan just in case you do get COVID-19 of how to get treatment if you need it.
Right. All right. Dr. Ihn, as always, thank you very much for your time and your thoughts. And Professor Ihn here in the studio, thank you so much for your insights today.
Thank you.
Right. Well, on that note, we end this week's editions of Issues and Insiders. It's the first weekend in the absence of indoor mask requirements in most places amid the pandemic, so do enjoy. See you next Monday.